When you're looking at a patient, there's this incredible trio of functions that can tell you just about everything you need to know about what's going on. We're talking about how the brain is thinking, how the heart is pumping, and how the lungs are breathing. Today, we're going to dive into how these three systems are so tightly woven together that a problem in one often screams for help through a symptom in another.
Okay, so let's kick things off with a classic clinical puzzle. You have a patient who suddenly becomes confused. Now, your first instinct might be, okay, this is a brain issue, right? But why does a sharp clinician immediately start checking their heart and their lungs? That's the big question we're going to unravel today. Keep that in the back of your mind as we go.
So here's our game plan. We'll start by introducing what I call the body's vital triangle. Then we'll break down cognition, which is our control center. After that, we'll get into perfusion, the body's delivery network. Then gas exchange, the fuel line. And finally, we'll connect all the dots and solve that puzzle.
So let's start with the big picture here, the vital triangle. The best way to think about this is like a three-legged stool. You've got the brain, the heart, and the lungs. If even one of those legs starts to wobble, the whole stool is at risk of toppling over. They are absolutely 100% dependent on each other.
And really, this is the golden rule of any good assessment. You just can't look at one system all by itself. A weak pulse isn't just a heart problem, and confusion isn't just a brain problem. You've got to ask yourself, okay, what are the other two legs of the stool doing? That's where you'll find the real story.
All right, first up is cognition. This is our body's command and control center. It's the mission control that processes everything, manages the whole operation, and tells everything else what to do.
So what do we actually mean by cognition? Well, as you can see here, it's this whole mental process of knowing and understanding what's going on. It's not just about memory, It's being able to see a friend and know who they are, deciding you want pizza for dinner, and understanding what I'm saying right now. It's basically the operating system that makes all the hardware in our body actually work.
And inside this whole world of cognition, there's this one piece that's super important, executive function. And I absolutely love this analogy of it being the CEO of the brain. This is the part of your brain that handles all the really complex stuff, planning, judgment, solving problems. It's also the most sensitive part. When the body gets stressed out, say from not getting enough oxygen, this CEO is the first one to show signs of trouble.
Okay, this is one of the most critical distinctions you will ever make in practice, telling the difference between dementia and delirium. Think of dementia as a slow burn. It develops gradually over years. But delirium is a lightning strike. It comes on suddenly. And that suddenness, right there, that is your giant flashing neon sign that there's a new acute medical problem that needs your immediate attention. So, when you spot any of these red flags, things like a sudden change in consciousness or brand new slurred speech, this is not a let's wait and see kind of problem. This is a 5-alarm fire. This is the brain's smoke alarm blaring, telling you that mission control is in serious, immediate danger. Okay, so if the brain is our control center, how does it get its power? Well, that brings us to our second pillar, perfusion. This is the body's absolutely critical delivery network. It's the system that gets fuel and all the essential resources to every single cell.
At its simplest, perfusion is just blood flow, but I want you to think of it more like the body's own amazing courier service. It's this massive network of highways and tiny little side streets that delivers packages of oxygen and nutrients to trillions of cells. And, just as important, it picks up the trash, like carbon dioxide. If that delivery service grinds to a halt, the whole system shuts down. And the engine driving this whole delivery network? It's the heart's amazing electrical system. It all starts with a little spark from the SA node. That's the pacemaker. That signal travels down, takes a quick pause at the AV node. That's to let the bottom chambers fill up with blood. Then it spurts down the bundle branches and triggers that final, powerful squeeze from the Purkinje fibers. It's just a beautiful, perfectly timed dance.
Now, this number right here, burn this into your brain, 60. This is about the mean arterial pressure, or MAP. It's basically the average pressure in your arteries over one heartbeat. If that number drops below 60, it's like the water pressure in your house suddenly getting super weak. There's just not enough force to push blood up to the vital organs, especially the one at the very top, the brain. This is a critical danger zone.
So what happens when this delivery network starts to fail? Well, at first you get something called ischemia. Seriously, think about it like a houseplant that you forgot to water. It's starting to wilt. The cells are stressed, they're injured. But if you give them some water, or in this case blood flow, they can bounce back. But if you wait too long, that's infarction. The plant's not just wilted anymore, it's dead. The tissue is gone. That's a heart attack or a stroke, and that damage is irreversible.
And that leads us perfectly to our third and final pillar, gas exchange. So if perfusion is the delivery truck, gas exchange is all about loading that truck with oxygen and, just as important, hauling away the garbage, the carbon dioxide. It's the body's fuel line.
This right here, this is the fundamental job of our lungs. It is this constant, vital trade-off. Our body brings in the oxygen it desperately needs to make energy, and it gets rid of the carbon dioxide waste that's created. With every single breath you take, you're powering trillions of tiny little engines inside your cells. If this exchange stops, those engines just sputter out.
Okay, now this is a super important difference, so let's slow down for a second. Hypoxemia versus hypoxia. Hypoxemia means you've got low oxygen in your blood. So think of it this way. The delivery trucks on the highway don't have enough packages. Hypoxia, on the other hand, means the tissues themselves, the cells, aren't getting enough oxygen. So the customer at the end of the delivery route is starving. You see the difference? A lack of packages on the truck will definitely lead to a starving customer, but they are two distinct points in the process.
And you know, one of the best ways to check on gas exchange is surprisingly low tech. It's a stethoscope. What you hear tells you a story. If you hear crackles, it sounds like Rice Krispies popping. That points to fluid in the lungs. If you hear wheezes, that high-pitched whistle, that's a sign of tight, narrow airways. These aren't just random noises. They are physical clues telling you exactly why the fuel line is failing. All right, so we've got our three pillars: cognition, the control center; perfusion, the delivery network; and gas exchange, the fuel line. Now let's put all the pieces of the puzzle together and answer that first big question. Why does a heart or lung problem make a patient confused?
It all kicks off with a problem in that delivery network. So let's say the heart pump is weak, or the blood pressure is tanking. The bottom line is, you've got poor perfusion.
Now, if blood isn't moving the way it should be through the lungs, it just can't do its job. It can't pick up enough oxygen, and it can't get rid of that carbon dioxide. So a perfusion problem almost instantly creates a gas exchange problem. And which organ is the biggest diva in the body? The one that demands the most energy and is the most sensitive to even a tiny dip in its oxygen supply? You guessed it, the brain. Our control center needs a constant, rich flow of oxygenated blood to function. So when gas exchange starts to fail, the brain is the very first to feel it.
And boom, there's our answer. That drop in oxygen just throws the brain's delicate chemistry into total chaos. And that chaos shows up as a sudden, acute change in thinking, what we call delirium. The problem didn't start in the brain. The symptoms showed up in the brain, but the cause was down in the heart or the lungs.
So let's circle all the way back to our original question. Your patient's thinking suddenly changes. Where do you look first? The brain? The heart? The lungs? The expert clinician knows the only correct answer is all three, all at the same time. Because in the human body, the head, the heart, and the lungs are never, ever telling separate stories. They're always telling one.